How long should I take before taking the test a second time? I failed once and I feel like I have to study a lot and I'll never feel ready. The first thing that you need to do is that you need to manage your time. I don't know if everybody knows this, but we all have the same 24 hours in one day. How you spend that 24 hours is completely up to you. Or it may not be completely up to you because you may have kids, spouse may be working and you're the only person at home. You may be a single parent. Some people have learning disabilities. Some people work, 2 or 3 jobs. There are a plethora of things that can handle your time management. But here's one thing: how uncomfortable are you willing to be for you to be successful later on? Are you willing to be uncomfortable for 2 or 3 months while you're studying for Nclex so you could, have a life, get back to your normal life? Or do you want to just keep consistently studying and making excuses for yourself? So time management. Now, one thing that I will say is about Picmonic. And they do have this weekly Nclex workbook, which I think is absolutely fantastic, which is crazy because I didn't get this until after I passed. The funny thing about this book is that it has all the content laid out for you every day by the hour on what you need to study. And it's super driven for content, and the content is amazing. Probably one of the best things about it is that you can check it off. It has word searches, it has all different types of pictures. But the best thing about it is that it holds you accountable. Like Picmonic already did all the work for you. And here's the thing, this is based off of 4 weeks, but you can make your own calendar. If you want to take 8 weeks to study because you know that you can't sit in front of a computer or for a book for so long, then go ahead and put, I'm going to study antibiotics and how they affect the body. And what are the big things about vancomycin? Or like my favorite Picmonic in here, which is Pencil Villain. And funny thing about Pencil Villain, let's talk about him real quick. I don't know if anybody watches Rick and Morty, but I'm a big Rick and Morty fan. And the whole time I was calling him Pencilvester because he looks exactly like Pencilvester. So I don't know, I have no idea what the artists were doing, but I know for a fact that they got that idea from Rick and Morty. So shout out to the artists for doing that. I thought that was actually kind of funny. And that's actually one of those things that really stuck in my head.
You're right.
That's the biggest thing that will help you on your way of creating a pattern for yourself. And with that time management, you have to incorporate content. And the content is in this book or whatever content that you want to study. So for me, I know that pediatrics and pharmacology were the worst for me. Little people scare me. Yes, I said little people. And pharmacology is just a monster on so many levels. And it's even worse when I'm working in a burn unit, and it's just a monster of just how they affect the body. And we're learning it right here for the Nclex on a basic level. So when you guys get out there to your units or wherever you guys go as nurses, it can be very, very taxing intelligent wise. But we all can do it. You can do it. You also want to incorporate quizzes in there. So content quizzes. I studied anywhere from 75 to 150 questions every day. And then the closer that I got to Nclex, it went from every day to every other day. So then I would do content at one point, and then I would do my questions and answers. Now, as you're answering your questions and your answers, the biggest thing that you want to do is that you want to go back and you want to read and remediate. Even if you got the question right, you want to read and remediate, because one thing I will tell you, content is king. You will hear that everywhere. Either if you're creating YouTube videos, if you're creating, podcasts, content is king. If you don't understand the content that you're learning, you will not be able to apply it to Nclex style questions. Nclex style questions are critical. So you want to be able to understand your content in order to apply it to your questions. A couple of other tools that I used Kaplan. I loved Kaplan when I used them. There were a plethora of other things that I used, such as Mark Clemek's audio. Like I said, if no one's ever listened to Mark Clemek's audio, if you can find it and, acquire it, then it is a wonderful tool. But of course, I say go support him. His audio is fantastic. I would listen to it everywhere. If I was driving to work, if I was driving home from work, mowing the lawn, in the shower. Yeah, I said it, in the shower with a speaker, because we got to be safe around here. So Mark Clemek was great. And then of course, Picmonic's YouTube, fantastic, right? Other tools that I used was Registered Nurse RN, and let's talk about Nurse Sarah, right? let's just be real. We all know that if we could give her our tuition money, we would. So shout out to Nurse Sarah, registered nurse RN. She's doing great things over there. Remar Nursing, of course, Regina doing her thing. Khan Academy, which was fantastic for me when I used it at the beginning. And UWorld for NCLEX style questions. And there's also another one out there called Archer, which is kind of like UWorld, but a little cheaper. I didn't say that. Those are the things that you can use when it comes to like kind of like diversifying your portfolio, finding different things that help you do and understand everything from different angles, because we all know that some books say one thing, some books say another, but in the end, they're going to all use relatively the same type of material to create questions. Another thing, part of my tips is that when you go to take your NCLEX, do not expect to take the NCLEX with 75 questions. Do not go in there expecting to take the minimum amount of questions. Go in there and expect to go all the way. Go the distance. Go the distance like Rocky. I talked about that in the video. It was funny at some point for some people who have seen Rocky and some people who haven't. It's a great movie. When I was in school, all the professors talked about was 75 questions, you want 75 questions. I was like, but if I get 75 questions, when I hit question 76, then the first thing that I'm going to do is like, my heart's going to fall through my back. Like, really? So go in there expecting to do all 145 questions. When I did it, it was 265. When the first 3 times I did it. And then of course, when I had my COVID edition questions, I don't know if I can say that. Hopefully that doesn't get demonetized. But those questions, I had 60. And it was a max of 130 at that point. But still, it's still the same concept for you guys. So when you go in there, study like you're gonna be there for the whole 5 hours. And then if you're only there for an hour, then you're good to go. You're good to go at that point, right? But it's kind of like where for athletes, it's like you practice your hardest in practice for you to get a spot so you can show out at the game. And then when so going to NCLEX is like showing out at the game. You know all your plays, you know everything that you're going in there for. You feel confident, you go in there, boom, you're done, and you can leave with your head held high. Another thing that I like to say is do not study the day before your NCLEX. So today is Thursday. Let's just say your NCLEX was tomorrow. Today would be a day that you don't study for your NCLEX. I had an instructor. His name was Cedric Brown. He was my instructor when I went to core school way back when. And when we were studying to be corpsmen, and he saw a bunch of us cramming in the books, and he was just like, just put the books away. He was like, because you've had plenty of time to study for this exam. So if you're trying to cram the day before your exam, then that's a problem, because if you don't know it by now, then you don't know it at all. And that's a philosophy that I've always lived by ever since he said that. If you make yourself a proper study guide and a proper plan for yourself, then you shouldn't have to study the day before. The day before should be a day of trying to relax, because I know it's overwhelming. I know you're super nervous and you could be a wreck. Don't try to go out there and party a day before, because I know a girl who did that, and she went out there and was just like, oh no, I'm turning up. And I was like, well, shouldn't you turn up after you take your exam? Like after? And turn up even better, like after you pass? But hey, common sense isn't always common sometimes. So definitely don't cram the day before the exam. Try to relax, try to watch a movie. I don't know what movie's out. WandaVision's great. This is not sponsored by that. I'm just saying it's a good show. Another thing, get plenty of sleep and prepare the day before. So what I did is I put out my outfit. I had my ID there. I had my keys there. I had my shoes lined up. I even put my toothbrush. I had toothbrush and toothpaste and all that stuff lined up on the counter. So I already know I was already going to have a bad time sleeping. So I went to bed early, like at 8 o'clock. Took a melatonin. That's just me personally. I took one of those, fell asleep, woke up at 9, and did everything I needed to do because my exam was at 1. And the great thing about my exam being at 1 is because every single time I did a practice exam, it was around 1 o'clock. So just make sure that you guys prepare the day before. Try to get 8 hours of sleep. Just, try to get some type of quality sleep with that. It's okay to not know everything. Like, you are not meant to know everything. Mark says in one of his audios, even if you're acing it, they're going to pull out stuff that you don't know. The biggest thing that you need to know is you need to know what everybody else knows. Like, I understand that you want to know about all these crazy EKGs, but do you understand what normal sinus rhythm looks like? Or do you understand when it's not normal sinus rhythm that, hey, I should probably go check on my patient or something like that? Or do I know best versus first questions? Because first are based off of a list and best is, hey, if I could only do one thing and then leave the room, what would it be? So if a patient had an issue breathing, the first thing I would do would be what? Is it give them oxygen or lift head of bed? Boom, I want to lift the head of bed because it's based off of a list. If it was a best question, do I want to lift the head of bed or do I want to give them O2? I would rather want to give them O2 if I knew I was going to leave the bed because I'm giving them that supplemental oxygen so it can bring their O2 sats up. And there's a lot of questions. Remember, this test is computer adaptive. So there's a lot of questions up to like 6,000 or 10,000 or something super crazy like that. So it's okay if you're not going to know everything. Stay away from negativity. That's the last thing I would say. Stay away from negativity, whether it be friends or spouses or any significant other or people, just any type of negativity. There was one girl I know who she had 3 kids and a husband at home. Husband was super supportive. She had to go get a hotel the last 2 days. And she did well. Like she called, check on the kids, but she had her own alone time and it was quiet. And so she went to go take the test and she was pretty successful at that. So make sure that you try to keep negativity out as much as possible. And that's pretty much it. Like, I just want to make sure that everybody has a good understanding of what they're getting themselves into when they're going to take their exam. Because the biggest thing for me is that even though people were telling you about it, it's like that unknown of like, hey, what should I look at? How should I study? What material should it be? So on and so forth. Now this segues us into our Q&A. So first question is, what components of nursing you would have liked to know before taking your first NCLEX exam? The biggest thing about nursing that I wish I would have known were just the understandings of how to answer NCLEX style questions. It wasn't like, because for example, like when you're going through school, the school only puts out, like they make their own tests, but then like when you, like at least for us, they make their own tests. And then at the end, we took a HESI exam, which was NCLEX style. And so I'm just like, how do we study NCLEX style? And people were just like, you just have to study. So I think the biggest thing for me is that I wish I could have gotten way more exposure to NCLEX style questions and help understanding NCLEX style questions way earlier. And I think I would have been successful on taking my first exam. So that was a good question. How can I download your book? What book? I don't know what book you mean. Will the NCLEX be timed? Yes, the NCLEX will be timed. Funny thing that they don't tell you, or some people that don't tell you, is that on the top right-hand corner when you're taking the NCLEX, it has a button to where you can hide the time and you can hide the questions. So for me, since I had huge test anxiety, and a lot of people do, you can click those buttons and it'll hide the time and it'll hide the questions. So you can go at your own pace. So originally the test was 6 hours long and you could take as many breaks as you wanted. But however, once you start your exam, the time keeps going. It doesn't stop even when you take a break. So if you take a 15-minute break, that's 15 minutes off of your exam. So just be mindful of that. But yes, the NCLEX is timed. And I believe right now it is 5 hours for 75 to 145 questions. That was a good question. Do students need to memorize each of the cranial nerves and their functions for the NCLEX? So the cranial nerves are, when you're studying the cranial nerves, especially like if you're in your first semester of nursing school, is for you to get an understanding of what those cranial nerves do. So on the NCLEX, if you're getting asked, hey, what does cranial nerve 12 do? That is what they like to call a below the level question. Now, if I ask you a question about cranial nerves in the sense of a patient reports to the emergency department with X, Y, and Z, you need to know what cranial nerve 12 is and how it affects the body. And then it'll put them in the question form, but it won't say what cranial nerve 12 does. It'll just tell you that, hey, this is the issue that's happening, and then you have to be able to answer it. Because remember, there'll be 2 answers that'll just be completely wrong, and then 2 answers, there'll be 1 answer that's right, and then there'll be another answer that's more right. Okay, so no, you don't need to memorize. It's all about being familiar. So you need to know that, but you don't have to memorize it. If you try to memorize everything, you're gonna go crazy. Next question, are COVID topics already included on the NCLEX? No, they are not. The last time I checked, they are not on the NCLEX at all. However, if you guys go to the ESPN, wow, I'm watching way too much sports. If you guys go to the ncsbn.org website, they will be able to tell you the most updated portions that are happening within the Nclex exam. So as of right now, COVID questions are not a part of the Nclex. Did you use the report that the Board of Nursing sends after not passing the exam? Yes, I did. I wish I had it. I may be able to find it. I doubt it because I have so many papers in here. Oh, nope, that's not it. So I actually did get that. And my first one I got, it pretty much said, there's actually one of my video, my video where it says that I failed Nclex, I actually put up all three of them and I showed where my standings were in regards to when I took the exam. When the first time I took the exam, everything was below passing, except for a few that were above passing and one that was like near passing. The second time I took the exam, everything was near pass. A few were below, more were near, and then there was like one or two that were above. And then the third time I passed, everything was near passing. So that told me I was teetering the line of the passing line for Nclex. And then of course, the fourth time I took it, you don't get one. If you pass the exam, you won't get a breakdown if you fail because obviously you passed it. So, and I used those breakdowns to help me figure out where I was lacking at. And I know pediatrics was one, and and pharmacology was another. So there's 8 portions of the Nclex pie, so to speak, right? Pharmacology, physiological adaptations, and management of care. Those 3 make up 40 to 49% of the Nclex. So if you can really do well there, then and do well in other areas, you're going to shatter that exam. How early should you arrive at the testing center? So that's a good question. I arrive, it says on the paper once you register, it says that you should arrive about 15 minutes prior. That way you can park your car, use the bathroom, check in, because sometimes those lines are long and sometimes they're not, because they don't only proctor nursing exams. There was somebody there that was taking their social work exam, somebody was doing architecture, another girl was doing education. So there are other people that are using this testing exam. And now with the testing centers and COVID precautions, the lines could be a little bit longer. So I would say give yourself about a good half an hour, 45 minutes to kind of get those pregame jitters out, check in, use the bathroom, go to your car, use the bathroom again, because you might. But yeah, I would say give yourself about a good 30 to 45 minutes. And then before you know it, time is going to be flying. How long should I take before taking the test the second time? I failed once and I feel like I have to study a lot and I'll never feel ready. So first time I took the exam was October of 2018. Second time I took it was July of 2019. I would not recommend doing it, waiting that long. I got inside my head and I was feeling super nervous and I was feeling down. I would say register for it as fast as you can. And the reason why I say that is because you keep retaining it. You keep retaining all that information. And if you set, and the biggest thing for myself is that if you set an Nclex date, once you set it, you're locked onto it. So now the time is starting to tick down to where I need to hit these wickets that I need to hit. I need to do content. I need to do my questions. I need to do content, so on and so forth. What is the best strategy for select all that apply questions on the Nclex? The good old Satan questions, as they call them. At least for me, there were all of the things that you need to know were, when selecting all of them, you'll know the ones that aren't right. So you can just go ahead and eliminate them. So a lot of times for me personally, I wasn't always the best at select all apply questions. Like I'm not even gonna sit here and front with you. The biggest thing for me, it was just doing them. It was understanding the question and then doing them and seeing which ones fit and which ones didn't. The biggest mistake that people do is that they always select over by one. And now with the Nclex is that either one can be it, multiple could be it, or all of them could be it. Now, when it comes to one of them and all of them being correct, it is very rare, but it is not impossible. So if you believe that it's right, then answer all of them. There are a lot of the testing banks out there, they'll do that. Like when I was using Kaplan, and when I was using UWorld, it was the same exact thing. I had probably like 4 or 5 questions that were select all apply in a row. And out of those 5, there were probably 2 or 3 of them that all of them were correct. So honestly, it is just doing them, getting familiar with them and understanding understanding the question as well as reading as thorough as possible the answers, because one or two words can throw it off and make it right. If you're not able to minimize distractions, i.e. negative people, what is the next best step to keep focused? So for me personally, I like to call this a reevaluation period. If you are being distracted by negative people who say that they are supportive of you, then that is a reevaluation period for you to take a step back and be like, does this person really support me? Because I see a lot of people that will say, oh, my friends tell me I don't hang out with them. And I was like, but your friends aren't going to nursing school. Your friends aren't taking this test. So you will really know who really supports you and who your real friends are after you finish nursing school. I can tell you that for a fact. There were a lot of people that I was friends with and a lot of people that I was cool with. And then after nursing school and after I took my Nclex, it was just like some people were there, a lot of them weren't, but that's okay because that's a sacrifice that you have to make for you in order for you to excel in life. How was your experience as a male nurse in nursing school, and did that have any impact on your studies? Out of my cohort, I believe I had 130 people. Out of 130 people, I want to say there were like 11 or 14 guys, and I was one of them. So my experience in nursing school as a male, honestly, like it wasn't that bad. And for those that don't know the numbers about nursing, 85 to 89% women, the rest is men. So it's a very female dominated occupation, which is fine. I don't know. I don't feel like I was treated any different. I kind of have a very not aggressive approach sometimes because I've been in the Navy for so long, or an assertive one. So some of my instructors were kind of, I don't know, but it was okay. I didn't think my experience was that bad. And for the impact on my studies, I'm a very social butterfly. So I believe in working in small groups. And so I found a group of girls, I call them my girls from Houston, as well as my girls in San Antonio, to where they helped me out a ton. And, you know, nursing and medicine is a team sport. So if there was something I didn't understand, I always reach out to one of them and vice versa. So the studying was great, but remember, you don't have to do it all by yourself. You don't have to do it all by yourself. You can find you a small group of people and you guys can work together. Teamwork makes the dream work. Some people hate that, but I'm just keeping it real. Any advice for keeping it simple? I tend to overstudy and get caught up in interesting, but otherwise unimportant for my exam details. I mean, it's just like you said, it's just like, you got to keep it simple. Don't, oh, I see. You're probably one of those individuals who are just like, wait, do they mean this or do they mean that? So there's a saying that we say, at least I used to say to my students, and we call it RTFQ. Well, I call it RTFQ. RTFQ. If you know what it means, then good to go. I mean, if you write it in the chat, I can't stop you from doing that. But RTFQ, right? And only answer what they are asking. Don't think about, but what about this? It doesn't say in your question, hey, blah, 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 blah. Oh, hey, and also think about this. No, it's asking you about one specific thing. So focus on that. And the best way to do it is just practice. You have to practice, and stay focused on just that question and what they're asking. Don't think about everything else, because everything else is not going to get you the correct answer for that question. What if in an Nclex question, there is a disorder or medication I've never heard of, which tends to happen a lot? True story. Would you say is a good technique to use? So here's a good thing about pharmacology. Like I'll talk about cardiac meds, right? So, and I'll use beta blockers, because we all know that they're all associated by their last portions of their name. So beta blockers, LOL, right? So we know that beta blockers decrease blood pressure as well as decrease heart rate, right? So if they threw out a medication, this is where you have to know your families and your suffixes for your medications. Once you understand where they fall in their family line, then you'll be able to understand. It doesn't matter what I throw. I could throw out labetalol, propanolol, any of those, right? But they all end in LOL. So I know that in the grand scheme of things, that they will lower blood pressure and they can lower heart rate. So if you see a medication that you don't know, then go look it up, and then look up what family it's correlated with, and then understand where the family names fall into part, or they fall into place, and then understand what is the the broadness of what it's asking. My school heavily focuses on using HESI throughout our entire nursing program. I know that feeling. Why would you say HESI isn't one of your favorite? For example, what makes HESI worse than other systems? I can't say that HESI is worse than any other systems. I only go off of what people have told me. So I had a friend who went to Chamberlain, and not Chamberlain, she went to, I think it was Chamberlain, and I think they use ATI. I may be wrong, but she used ATI and she was not a fan of ATI, but ATI is the only thing that she used. And I think it was just because of the quality of questions. And so for me, when I was taking HESI was giving me NCLEX style questions, but I didn't feel prepared based off of the content that was given up to that point, as well as the amount of stuff that was given for me to understand NCLEX style questions, to tackle NCLEX style questions that were given through HESI. And so there were just a lot of just confusing questions for me when I was taking it. And I just, me personally, I just wasn't a fan. But then like, if it works for you, then it works for you. A lot of people, some people liked it. Majority of people that I went to school with, that were in my cohort at least, did not like it. A few people, when I was doing clinicals, there were a bunch of people that used HESI and they didn't like it either. But I mean, it all just depends. Some, like I said, we had HESI, you have HESI, my friend had ATI, other people have Kaplan. And, you know, it's just all about, you know, how your personal experience was with it. It's just for me, I was not a fan of HESI at all. How often should I do assessments before they take their NCLEX? How often should you do, an assessment, like testing yourselves? Or I did an assessment 3 to 4 times a week. And then the last assessment that I did for myself to test myself to see how well I would pass the NCLEX, I took my NCLEX on a Wednesday, and I think the last one I did was on a Sunday. So if you can incorporate 2 to 3 assessments during the week and then dwindle it down, the closer that you get to your NCLEX, then that's fine. For me, like I said, I would do a quiz or something else, you know, at the end of the week or sometimes in the middle of the week, just so I would incorporate doing my questions, learning my content, and then doing a quiz or an assessment throughout my week. So however you tailor it to yourself and for your own personal life, then I would say try to do that. These are going to be our last 2 questions. Are we able to go back to the old questions and change the answers? No, you are not. Once you answer your question and you click forward, that's it. You can't go back. So I'm pretty sure every nursing student in here when they're taking their exams, it does that same thing. And the main reason why your school exams and your HESI, ATI, Kaplan, whichever ones you're using, do that is to prepare you for when you go and take your actual NCLEX. Because when you take your NCLEX, you can't go back. So be confident in your answer and then move forward. How well are you familiar with Kaplan Review and REMAR Review? Which one do you think is more helpful? I heard people retaking exam using REMAR Review a lot. When I failed my 3rd time, I used REMAR's Facebook page because she does a lot of motivational Mondays. I used her YouTube channel. And I also had a friend, a very close friend who used REMAR. And I like the structure of how she has it, to where it'll throw out questions and it'll throw out content, but it forces you to kind of answer the questions. And if you get it wrong, you have to go back. So it forces you to understand the question, but then some people will just be like, all right, I got that answer wrong, so I know it's going to take me back. And then they'll just fill it in until they get the answer right, but they're not learning anything. So that's like some people are just doing it just to get through it. But remember, you're paying money for these things. Either it be for Picmonic, either it be for Kaplan, for Mark Klimek or whatever. It all just depends. Like a lot of people like it, some people don't. Kaplan, I personally loved because it gave me everything that I needed under the sun from, you know, they did live webinars every day for every different area. I actually did a review on them as well. If you guys go check out my YouTube channel. Also, they give you NCLEX style questions. They give you assessments. They give you a readiness exam. They give you they give you content. They give you tons of just about all types of resource case studies. Kaplan's been around for a long time, but a lot of people don't want to pay that Kaplan premium. It's the same premium as if you paid for Hearst, which is like anywhere from like $200 to $300 to $400. But you know, when there's a sale, there's a sale. And then there's a lot of things that you guys, you can get, not prepaid, but you can make payments on. They have things and deals where you can do payments and stuff as well. So hopefully I was able to answer your question. Me personally, I like Kaplan. just to shorten that up, I like Kaplan a lot. So that's it on all the questions. I appreciate all the questions. You guys threw out a lot of good ones, and I appreciate that. Hopefully I was able to help. And if I wasn't able to help, you guys can find me on, at the Boot Nurse on Instagram. And I love to answer questions as much as I possibly can. So I appreciate everybody coming by and coming showing some love. This was a really good experience for me. First live stream ever. 4 things I want to leave you guys with is be flexible, because you never know where you're going to be. Don't overthink, observe everything, and tackle everything that you feel like you can get. All right. I don't know if you guys got that acronym, right? BOOT. I'm just saying, but thank you guys for coming. I appreciate it. And I will see you guys later.